Hey folks, this is Mario, and this is the second in my series of 3 videos describing my experiences with HPV-related throat cancer. I do have one separate video that just discusses vaccination, which I'm in favor of, as a way to prevent HPV-related cancers by preventing the HPV infection in the first place. Please check that one out also, and links for all the videos are provided below. As I say in all of them, these videos are just my experiences, not medical advice. So please, if you are facing this situation, please consult with your own medical professionals. Now, this video will focus on my actual treatment, which means the approximately 7 weeks during which I was going to the medical center practically on a daily basis, actively undergoing both radiation and chemotherapy treatments at the same time. I had rented an apartment for purposes of living near the medical center that I chose, and that was essential. My wife was a huge help in securing that housing in the first place, but she would now take a central role in my treatment as the caregiver. Because cancer treatment is so complicated and may even disable the patient, it is super important to have a designated caregiver, if at all possible, or more than one, I guess, to be intimately involved in the success of the treatment. It can be as simple as driving the patient to the treatment, or more complicated, such as monitoring the frequency of the medication or preparing the food that will nourish the patient during the treatment. Just a shout out to my lovely wife, Cindy. This was your finest hour in what has already been a lifetime of excellence. I love you, sweetie. So that's not to say that treatment is impossible without a designated caregiver. If you are about to start treatment and do not have an obvious choice, don't despair. Lots of people go through treatment being very independent. But if you need the extra help, whatever it might be, see if the hospital offers that directly or can help you arrange for it. Okay, back to the actual treatment. The plan for my treatment was during the weekdays only, Monday through Friday. Recall I had mentioned 2 different treatments, and I got them simultaneously. The first, radiation. It's just like it sounds. A machine literally shoots radiation rays at you, aimed at where the cancer is. The idea is to literally burn the tissue away. The problem is that the radiation burns a lot of healthy tissue too. I'll talk more about that. The second, chemotherapy. And I have to be honest, before this happened to me, I really didn't know what chemotherapy was. So it's a liquid, it's like a medicine. I've heard there are chemo pills also, but I got mine in a liquid form. And it went into my body via an IV in the arm. Basically pumped into my vein with a machine. It takes a couple of hours, once a week. The problem is that it makes you sick. Similar to the radiation, it attacks cells, the rapidly producing cells, which are theoretically the cancer ones. But it also attacks healthy cells, particularly in the stomach lining, which gives you nausea, which I got right away. Let's talk about the first 3 or 4 weeks, the first half, let's say, out of the 7 weeks total. I was given the choice of 2 different chemotherapy medicines. I chose what I would call the more traditional one, that's known to be effective but also known to have major side effects. If I remember correctly, this is a formulation that goes back to the 70s. It's called cisplatin, or an older name for it is cisplatinum, same thing. It's administered with an IV in the pump. The pumping doesn't hurt, but once, and I don't know if it was because I was dehydrated or what, I did experience a throbbing pain with each pump that I just had to, get through. It wasn't the worst. Anyway, this cisplatin is pretty extreme. I'm guessing this is part of where cancer treatment gets its bad reputation for making you sick. The first major symptom that I experienced was extreme drowsiness. I wasn't tired necessarily, but I just couldn't keep my eyes open. It was a very strange and unpleasant sensation. A close number 2 was the nausea I mentioned, and a loss of appetite. Other symptoms included tingling in the fingers, which is bad because that can become permanent, and some slight hearing loss. For some of these, there is medicine to treat the side effect, but even those medicines have their own side effects. For example, you get nausea, you get an anti-nausea medicine, but the anti-nausea medicine gave me, at least the first one we tried, gave me ridiculous hiccups. And these weren't like the sort of kind of fun, mild hiccups that you get every once in a while. These were hard, almost painful, and rapid and continual. So I stopped taking that anti-nausea medicine. I just dealt with the nausea instead. At the same time, I started managing constipation, another side effect. The chemo and the supporting medicine like pain relievers gives you constipation, so you have to monitor and treat that also. Constipation, it sounds like it's not a big deal, but it is. If you leave it alone, if you don't treat constipation, bad things can happen in your bowels. And I'll talk more about that in a little bit. So I was basically treating myself to get better from the thing that was supposed to make me feel better. I don't know if that makes sense, but oh well. Anyway, people talk about chemo as being a poison. I felt poisoned. It literally laid me out flat. I couldn't work, and I slept a lot. After 2 weeks of taking the cisplatin, I went to my oncologist. That's the name of the type of cancer doctor that specializes in chemotherapy. And I reported that I was having extreme symptoms. Fortunately, I was able to switch to a different type of chemo, this one called cetuximab. As I understand it, while cisplatin is a destroyer of tissue, this other chemo is more like an inhibitor, preventing the spread of the cancer cells while the radiation did its work. I felt like the two of them together worked well, kind of like a 1-2 punch. And while the cetuximab was definitely better in terms of side effects, it was still not perfect. The first day, I got a wicked headache lasting several hours. It was not your usual headache. It was like nothing I had ever experienced. More like a piercing right in the middle of the head every time I moved my head even a little bit. But this was only the first night. The other side effect was I had a rash-like acne. It basically got spots all over my chest, back, and face. This was only a nuisance, however. It didn't hurt, and within a few months, they were gone. And both of these, the headache and the acne, are known side effects of this particular chemo. I also had a fair amount of fatigue and some low-grade nausea that seemed to get worse as the treatment went on. I also got leg cramps because cetuximab takes away your natural levels of magnesium. And just like the hiccups and the headache, these weren't your typical leg cramps. These were like deep, uncomfortable, unusual cramps of the kind I had never really felt before. So I had to take a magnesium supplement, yet another medicine. Which brings me to another point. The doctors and the nurses recommend, and I had to keep, a daily log, writing down exactly which medicines I took and how often, but also my nutritional intake, what I ate, what I drank, and also how much I weighed on any given day, every day. The concern here was avoiding malnutrition. Just like the constipation, if you don't control it, bad things can happen to your body, like a downward spiral of bad health. In addition to all this, I had to do blood work every week, and I had a CAT scan also every week, but this might be because I agreed to do a research study at MD Anderson. CAT scans are tough because they involve a fairly long session, probably 15 minutes, inside of a machine which surrounds you, like you're in a tunnel. And it makes weird, loud noises. You have to get strapped in with the mask that I showed you in the last video and try not to move. It's easy to get freaked out. I was lucky though, most of the time I just fell asleep. I also had to do swallowing exercises. There were a bunch of them. Also like stretching your neck, holding out your tongue, swallow, cough, swallow, that kind of thing. There were a bunch of them. The goal was to keep your swallowing function as healthy as possible because your throat was being damaged by radiation. I also had to do baking soda rinses in my mouth to control bacteria levels and avoid thrush. So that's a good overview of the first few weeks. Let's talk about the last few weeks. The key difference is that in the last half I had trouble with the chemo, but I didn't have any trouble with the radiation. And the last few weeks that totally switched, complete reversal. My chemo side effects were pretty much under control with the change in the chemo, but the effects, the repeated effects of the radiation really started to kick in about week 4 or 5. Remember, the radiation basically burns you first on the inside, since that tissue is more sensitive, but eventually on the outside as well. So it caused a few problems. First, and this was a major issue, I experienced a severe impairment of my sense of taste, or sometimes a complete loss of the sense of taste. Even water, regular old water, it tasted burnt to me. It's very strange. And this really messed with my mind and was yet another reason why eating became a chore and sometimes difficult and distasteful. And I started to have saliva issues. Just because of where the salivary glands are located, they get damaged because of the radiation. So my saliva was first very excessive. And there was some surprise on the part of the medical folks that were treating me. Most patients experience a dryness from the beginning, but mine was the opposite. My salivary glands went into overproduction. I had to keep a spit cup even by my bed throughout the night, and man, that's a hassle. A little later, my saliva also started to thicken, which was a known effect, which just kind of made the whole thing worse. After treatment, however, my mouth did become dry, so now I had a shortage of saliva. And so overall, it was multiple stages of weird saliva stuff. The inside of my mouth was delicate also. Some people even get open sores, which I understand is very painful, but I was lucky enough to avoid those. Definitely no spicy food though, and I love spicy food. Not even like a little bit. By week 5 or 6 was also the first time I noticed hair loss. No one warned me about that one. People generally associate hair loss with chemo, but I was specifically told my chemo, either of them, would not cause hair loss. So that was great. I wasn't expecting that it was going to be the radiation that caused it. I lost hair in a strange pattern too, because that must have been the way that the radiation was passing through my neck. It was almost like 3 overlapping circles at the back of my hairline. I guess and what was interesting, the doctor said, well, it might grow back, which is a little scary because it didn't look so good. Fortunately, it did grow back, so yay. In these last few weeks also, the swallowing pain really jumped into high gear. I was on Tylenol with codeine first, but I had to go to a fentanyl patch, something stronger. A word on fentanyl. You may have seen it in the news. Fentanyl is an opioid, so you have to be careful. It is addictive. Fortunately, my one patch that I wore on my arm seemed like a reasonably low dosage and decently effective. I will mention, however, that opioid causes, guess what? Constipation. And during this time, I neglected to take a laxative. Well, for several days I neglected, just being stupid. And I had one very painful and scary episode of trying to pass a large bowel movement. So I'll say it again. If you're going through this, please make sure you are monitoring and managing your constipation. It's very important. I did experience some vomiting also, particularly after long car rides. I'm not sure if it was the radiation or the chemo, but it was overall not very often. The feeling of nausea overall, though, seemed to get worse in these later few weeks. I got to the point where even the thought of food made me queasy, and it's not fun at all. I also used the throat numbing liquid, which did not taste good, but it helped a little bit when I had to drink something. And you can imagine that during these last few weeks, it was very difficult to maintain weight. I had switched to a pure liquid diet just due to the swallowing pain. You have to do shakes like smoothies. Put some peanut butter in there, some spinach. You try to get enough nutrients. But it's also difficult to maintain basic hydration. I think the radiation dries you out. I was definitely drinking a recommended amount of water per day, but I think it was still not enough. And I'll talk more about that in the next video. Probably the worst thing though, or at least it's equally as bad as the other ones, I lost my voice entirely. I couldn't talk at all for about 2 or 3 weeks, which is pretty bad from a quality of life perspective. It kind of makes you feel a little bit helpless, like you've lost control over your own life. Anyway, so that's it for this video. In my next one, I'll talk more about what happened after treatment, especially the first few weeks, first couple of weeks after, when you're still healing. And then I'll take it right up through the present day, which is a year later. So thank you again for listening, and I'll see you next time.